In this video, what we're going to talk to you about is examination procedures to determine if the patient needs some acetyl-CoA factors and how you're going to determine this. We're going to do 3 simple tests, then we're going to do 3 a little more complicated neurological tests. And in our previous video, we talked about the physiology and the neurology of acetyl-CoA production and acetyl-CoA management of the parasympathetic and the sympathetic nervous systems. So this is how you're going to determine, does the patient need acetyl-CoA factors? So the first thing we're going to do is a series of therapy localizations. So we're going to start with an indicator muscle. Just hold here, push up to the ceiling. We're going to make sure autogenic inhibition is working properly. Push up again, which it is. So we've got a good measuring stick. So the first thing we're going to do is a procedure from the AK world called the B and E technique, or the beginning and ending technique. And the simplest way to access this is the acupuncture points on the face that are the beginning of a meridian or the end of a meridian are related to neurotransmitter function. Acupuncture point gallbladder 1 is related to acetylcholine and usually low acetylcholine. So in its simplest way, we're going to have the patient just touch right here. We're going to test our indicator muscle. If there's inhibition there, we know they could be low in acetyl-CoA. So now I'm going to do all the tests before I do any nutrition testing. But if this is the only one you find, okay, so just touch back here again, please. Then I'm going to have the patient simply just smell some of the acetyl-CoA factors and then retest and see, okay, does that facilitate? Very simple, easy to do. When it comes to the treatment of the B&E technique, that's a little more complex. So in our treatment video for acetyl-CoA, we'll talk about the complex treatment parameters for the B&E technique. The second group of things we can use is the command measuring point for the vagus nerve from electroacupuncture according to Voll. And this acupoint is located in between the second and the third metacarpal at the base of the metacarpal. So we're going to simply have the patient touch right there like that, and then retest our indicator muscle. If we have inhibition there, then we're going to have the patient smell the acetyl-CoA factors and then retest, and does that cause facilitation? Real simple. The third one is the vagus nerve has 3 areas where it comes to the surface. First is in the tragus of the ear, the second is in the submandibular area, and the third is at the carotid sinus. So I pick the carotid sinus. Why? Because it's the biggest portion of the nerve, and there's a celiac ganglion there of the vagus nerve. So we have more nerve volume there that we can tap into. So we're going to have the patient touch right at the carotid sinus at the bifurcation of the sternocleidomastoid and then test our indicator muscle. If we get inhibition there, we're going to then have the patient inhale some acetyl-CoA factors and then retest. So typically, I'm going to do all 3 things in a row before I do any nutrition testing. Test gallbladder 1, test, okay, and then just touch the vagus command measuring point and test. Then touch carotid sinus and test. Stay there. And then I'm going to just backtrack. Okay, just breathe in through your nose. Okay, does this facilitate? Okay, then touch gallbladder 1, breathe in, hold, does that facilitate? And then finally touch right there, breathe in through your nose, and does that facilitate? So fairly simple, 3 examination points. 1 or combination of those might be positive, and yes, you need to test both sides. The reason why is vagus nerve function on the right and the left side is a little bit different in terms of cardiac function. So I'm typically going to test both sides first, so checking 6 things before I do any nutrition testing. The second group of examination protocols we're going to use are a little more complex neurology, a lot more complex physiology, and a little more complex examination protocols. So the first is the oculocardiac reflex. So the first thing we're going to do, we're going to check subscapularis muscle on each side. Okay, so now I'm going to just test the one side just for the camera. You could do it this way. So if the patient is small enough and you can reach over, which I can in this case, I'm going to do it that way. So the next thing, just close your eyes, okay, and then open your eyes. Make your fingers look like this. Okay, and then just close your eyes and just touch your eyelids, very little pressure. Then I'm going to retest the subscapularis. Okay, and now press firmly on your eyeballs, push right here. And if we get inhibition, that's a positive oculocardiac reflex. And then we're going to just repeat that on the other side. Then what we'd have the patient do, okay, just put your hands back up, breathe in through your nose, push on your eyeballs firmly, please. Push right here. Does that facilitate? Fairly simple test. Neurology is a lot more complex. Physiology is even more complex, but easy to execute. The next two examination procedures really give us information about parasympathetic versus sympathetic function. And so we have the nicotinic receptors and the muscarinic receptors. So the nicotinic receptors, the way we're going to access this is we're going to check a rectus femoris muscle, just hold right here. But what we're going to do is see, can the patient hold a 15-second sustained contraction? So it's not stop and start, it's just push hard for a sustained 15 seconds. Okay, so I'm going to count you up. Okay, hold here. 1, 2, 3. And that's typically what we find. The patient won't be able to hold it very long. Now, before I test the nutrient on this, I'm going to do the muscarinic receptors. Now, the muscarinic receptors are, we've used this in the past if you're familiar with our long-term and short-term adrenal cortisol evaluation factors that we've used in our concussion protocols and our injury protocols. So we're going to go to an adrenal-related muscle. I'm going to suggest using the gracilis. It's the easiest one. You don't have to move the patient around. Okay, so squeeze your right leg to the left. Okay, and then we're going to shine a light in the nasal eye field by coming from the lateral aspect of the eye. Just, okay, squeeze right leg to the left. And if you get inhibition there, okay, that's positive for the muscarinic receptors. So now, what I'm going to do is have the patient, you can bend your knee, get ready. Okay, breathe in. Okay, and now hold for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, relax. And that's a pretty dramatic response, which is what you'll usually find. Is then we're going to just repeat it. So we're going to shine a light. Remember, it's the order of things that you do, it's important. You're going to shine a light in the eye, breathe in, and squeeze right leg to the left. Okay, and if that facilitates, then we know, yes, they need the AcetylCoA factors. Now, you may also want to check for eye stressed out and serorenew to raise parasympathetic function. Typically, the muscarinic receptors is going to be the better way to do that, as opposed to the nicotinic receptors with the rectus femoris. So we have 6 protocols that we're going to use to evaluate for AcetylCoA function. First one is therapy localized gallbladder 1 for a low AcetylCoA neurotransmitter. Second is therapy localized the VOL command measuring point. Third is therapy localized the bifurcation of the sternocleidomastoid. The fourth is, just close your eyes, touch your fingers, is the press hard on your eyeballs, is the oculocardiac reflex. Relax arms down. The fifth is the nicotinic receptors. Can the patient hold a 15-second contraction of the rectus femoris? And the final one is the muscarinic receptors. Shine a light in their lateral part of the eye into the nasal eye field to check in adrenal-related muscle. So here's how I'm typically going to do this when I am doing this evaluation on my patient. I'm going to evaluate all of those things first on both sides and see which ones are positive. Then I'm going to have them smell the AcetylCoA factors and see which ones change. Then I'm also going to see, okay, do we need to do some I6 factor for the inflammation response? Do we need to do some I stressed out for the elevated cortisol, which will suppress AcetylCoA production? Do we need to do some serorenew to promote neurotransmitter raw materials to make more neurotransmitters to balance brain function? The way we're going to dose the AcetylCoA is typically 1 capsule 3 times a day at mealtime or with some food. It tends to work better there, so there's no food restrictions. So they typically could be on AcetylCoA 1-3 times, I stressed out 1-3 times a day, chewing it of course, and then serorenew 1-3 times. In our next video, we're going to talk about treatment parameters and treatment things you can do to help raise AcetylCoA function. So until next time, this is Dr. Mladenoff signing off from Sedca-Ceutics.